Hello, I am Dr. K. Paul Stoller, and this short video is about the modified mRNA gene therapy bioweapons adverse events, as the jab has been associated with numerous side effects since their widespread release to the public. Cardiovascular complications include myocarditis and pericarditis, Takotsubo cardiomyopathy, postural orthostatic tachycardia syndrome, POTS, arrhythmias, sudden cardiac death, and cardiac tamponade. Pulmonary complications are pulmonary embolism, PE, interstitial lung disease, ILD, idiopathic pulmonary fibrosis, IPF, pneumonia, eosinophilic granulomatosis with polyangiitis, pneumonitis, and pulmonary hypertension. Do I need to go on? How about the analysis of Thorpe et al. 2022 that reported significant harms to pregnant women and infants? Using data collected by the Vaccine Adverse Events Reporting System, VARS database, which typically underreports by 99%, the adverse events reported after COVID-19 vaccines, with those reported after influenza vaccines, was significantly increased for COVID-19 vaccine for menstrual abnormality, miscarriage, fetal chromosomal abnormalities, fetal malformation, fetal cystic hygroma, fetal cardiac disorders, fetal cardiac arrest, fetal arrhythmias, fetal vascular malperfusion, fetal growth abnormalities, fetal abnormal surveillance, placental thrombosis, fetal death, stillbirth, low amniotic fluid, preeclampsia, premature delivery, preterm premature rupture of membrane, and premature baby death. When normalized by time available, doses given, or number of persons vaccinated, all COVID-19 vaccine adverse events far exceed the safety signal on all recognized thresholds. Dr. Peter McCulloch also steps in, calling out the devastating effects of the modified mRNA bioweapon. We need to remind RFK Jr., Robert Kennedy Jr., Secretary of HHS, that the time for navel-gazing is over, even as the FDA approved Spikevax, another Moderna mod mRNA jab for infants as young as 6 months. And do not forget one issue in that, besides the scam of this pandemic and the deadly Operation Warp Speed, there were some very nasty actors in the U.S. government too. NIH, FDA, NIAID, etc. People like Fauci and Barrick et al. These people did cook up CoV-2 and had it released, which then killed many millions. CoV-2 was real. But it failed to perform, less deadly than the flu it was. But that was where the bioweapon jab, which was only intended to clean up the survivors of the global democide, had to come to the fore and carry the burden of causing mass death. We must not wait for another manufactured catastrophic crisis, where we are prevented from making our own basic personal decisions or accessing needed drugs and response tools. The best way to do that is to hold those responsible accountable for their actions and deeds. Every single one of them is walking around as free humans. No one has been held accountable, so will they do it again? Why wouldn't they? And I am not just talking about Fauci, whose fate is sealed. It was always the plan to throw him under the bus if needed. This was a military operation. This was all run by the military, and heads need to roll.